So the perioperative surgical home is an approach to patient health care around the time of surgery. It starts when the patient's identified that a surgery is needed. So it starts in the surgeon's office. The patient is flagged to come to our clinic, and we essentially evaluate what they might need around the time of surgery. That includes a full history and physical exam, assessment of medication needs, or any other coordination of specialty care that someone might need.
The PSH in a nutshell is like having the answers to a test before you take it. You show up that day, everything's been done ahead of time, you check in, you have your procedure, you go home. It's the best, safest way to have a procedure done.
We like to see children about 2 to 3 weeks before their surgery, so that if we need to do anything special for your child to make sure that they're ready for surgery, we have time to get that prepared and get it done before the surgery time. We also have the opportunity to call in any specialists to get the lab work back, and also make any arrangements if we've encountered anything that is a problem, that we can talk to your surgeon and make sure everything is arranged.
A patient sees multiple providers over multiple days or even weeks in advance of surgery. We aim to condense that into one easy visit where our team assesses the patient's needs and coordinates all of that care for them.
Child Life will meet with your child that day. They'll talk to them on their level, provide them with items that they might see on that day so that they can actually play with them. They'll help you know how to talk to them and prepare them for any questions that they might ask you as well.
I like PSH because it, to me, represents efficiency and safety. Every child, from the minute they leave the office to be evaluated for potential surgery, to the minute they leave the surgery center after their surgery, they've been prepared every moment of the way. So that's the most efficient, safe way to have anything done, whether you're having blood drawn or having a major surgical procedure.
We're able to identify if the child needs some additional services, either from a specialist. If they need lab work, we try to get that done ahead of time. We try to get as many things done beforehand so that the morning of surgery, it's just wrapping up a couple of loose ends and primarily just having you, your surgeon, and your child come to the hospital, and everything is ready to go, and it's a smooth transition from pre-op right into the surgery suite.
Oh, we get feedback constantly. I'll send patients from my office after I see them and I schedule them for surgery, and I'll actually pass them a couple hours later when I'm walking across the Sky Bridge, and they'll stop me and say, "That was the best visit I ever had." They said, "I can't believe in 1 hour I saw you. I was prepped for my surgery. I'm having my surgery next week, and my child knows exactly what they're going to expect." They know the destination, so the anxiety goes from here to here. Family's happy, kids happy, outcomes are good. It's good for families. Yeah.